Hey, it's Dr. Ellen Wood. Happy, I guess, National Infertility Awareness Week. I am going to be answering questions, and we're going to be hearing a patient's story tonight with Dr. Ferraduro. And this is going to be great. This has been such a wonderful week. I'm wearing my orange in recognition of National Fertility Awareness Week. I'm on the IVFMD Instagram page tonight. I also have my own at Dr. Ellen Wood. I've just invited Dr. Duro. Welcome to join me. This is wonderful. Hey, how are you?
How are you? I
Great,
tried to
great,
wear
great.
orange, but it was like red, so.
It was like I will again. If I actually own two orange shirts. I wore a different one last year, and this is this year's. This one's a little brighter.
Yeah.
Um, but it's kind of an exciting week. I mean, the whole kind of theme is to change the conversation, just raise awareness about infertility, not let patients be embarrassed that they're infertile, have them talk about it, and just help them feel not alone. There's help, there's hope, and again, that's the point of this entire week and all of these things that we do. I know we have a patient joining us tonight. Hopefully I can figure out how to add her in. Like that was a little bit of a challenge last time. But Dr. Duro,
Oh,
you
it
can
just
introduce
popped up.
yourself.
Yeah, she just popped up, Erica. Welcome. There she is. If Erica, you can request to join, and then Dr. Wood will invite you in whenever you request. Hit the request button, and then we'll all be on the screen at the same time. So much fun. So my name is Farah Duro. I'm a licensed acupuncture physician, and I specialize in reproductive health. We are in Hialeah Gardens, and we work with patients who are undergoing IVF and also trying naturally. We work with pregnancy, work with pain. So it's exciting. This week has been really exciting and full of hope and amazing stories. We were excited about sharing Erica's story with you as well. She is going to be here to talk to you about what her struggle was. I think that a lot of you will get so much information out of this, even if you think that it maybe isn't exactly your situation. It's going to be very helpful to hear from her. And she saw both of us, and she actually introduced me to Stella earlier today. She brought her little one, and I put Stella on our story. She's adorable. She has these cute little cheeks. But anyway, she will be here, and then we have questions too we can get. So
We have a ton of questions tonight.
Yeah,
We have a ton of questions. So it just says we're waiting for her to join. So
okay, well, we can maybe
hopefully
get to
this
some questions
hopefully
and then
this hopefully this hopefully
yeah.
this works. I mean, I'm pretty sure I did it right. So hopefully. All right, so let's start on just a few questions that we had a bunch of them submitted earlier. Oh, she says it's unable to join. What did I do wrong?
Erica, if you're hearing us, just join from your phone and not your computer, just in
Yeah,
case.
it says, let's try to invite again, send request. Yeah, phone or a tablet work better than a computer.
Oh yeah, she's like, I'm here.
I'm here. I know you're here. I see you here. All right. Well,
Oh,
let's just do a few questions while we're trying to
yeah.
figure out that technical thing. But we did work before, so we can do it. Okay. So this is cool. We had like a ridiculous amount of questions submitted earlier,
Yeah.
and let me get to start them. So one question was, this is an easy one. What does spotting the day of a positive ovulation test mean? So normally you shouldn't spot the day of a positive ovulation test. You should actually spot as you ovulate, because what happens as your egg pops is that the estrogen level drops. So with that drop in estrogen, that some people it's very significant, you get a little bit of instability in the lining of the uterus, and then you get a little spotting. So it really shouldn't drop with the LH surge. It should drop maybe 36 to 48 hours later. That's completely normal. And she's still unable to join. Oh no.
Oh, let's see. Erica, can you
Try.
add in the comments because I can't check my text messages well.
Yeah,
So,
I lost her on here because I'm
it's
trying to
saying
invite her.
that you're pointing down and click request to join. So
Yeah,
maybe,
I lost her on the send invites too, so I'm not sure.
okay, so maybe just try again. And sorry, I can't read your text because I will lose connection, I think. I don't know. Well, we'll see.
Well,
But if type you can type what's going on. Oh, there has to be an update. That's right, 'cause this is a new feature. Shirley's
Yes.
got to update your phone for this, probably. Yeah.
Yes, yes, it was a new feature. True.
Okay.
Well,
So
do the
the question,
update and let us know when it goes through, and we'll let you on, because I can't. I mean, again, I think our listeners and everyone who's watching would really love to hear Erica's story, because Erica
yeah.
is a true warrior. Like, and again, you know, Erica's situation even tried to beat me down, and I said to her, I'm gonna win. I am gonna win. I'm like, and I did.
I remember her
So
telling
that was,
me.
yeah, I'm gonna win. There's no way your ovaries are gonna beat me. No.
Yeah.
And I won.
Yeah.
So anyway, so Mike, just back to the other first question we had. So the spotting, okay, completely normal at the time of ovulation. Again, shouldn't really happen before that. If it happens before that, then you might want to be investigated for maybe an infection going on in the uterus, or some type of lesion or growth in the uterus that could certainly cause an inflammatory condition that would cause spotting. Question just came across the feed. If I get a first dose of Pfizer, how long should I wait until I transfer? My only bias about the vaccine, and this is not published anywhere, okay, because I do believe that everyone, should get vaccinated. My concern is the fever that has been reported after the first dose sometimes, and clearly in women after the second dose. I don't like any of my patients around the time of implantation or in the first trimester to get a fever. Like, it's just my personal bias, okay? I don't care whether you catch the flu, you get a GI bug. I just don't want you to have a fever, which is why, like, women shouldn't go into hot tubs. They're trying to get pregnant. Women in early pregnancy shouldn't try to get. So fever concerns me. Tylenol can kind of abate that fever, but that is my only bias to patients, avoiding a vaccine if they're trying to conceive or early pregnant, is that fever. So just, get it out of the way before you have your transfer. Or if you're pregnant, once everything is formed in the fetus's body at 12 plus weeks, get the vaccine at that point. That's just, again, my personal bias. There's no medical literature on that. It's just, people get a fever around the time of embryo transfer. They're never pregnant. People get a fever in the first trimester of pregnancy. It is a risk for pregnancy loss. So my only bias. So, and again, because it's been a reported side effect, I mean, I had it, my daughter had it, and it's, you have 4 to 6 hours of sweats and chills, and then it goes away. But I don't want pregnant women to have that. It's just intuitively, it doesn't seem like a great idea. So my transfer is 3 weeks. How many sessions of acupuncture? Oh, you can answer that one.
Yeah, twice a week, definitely. I mean, it depends on your situation. Sometimes 3 times a week we do, prior to the transfer if you haven't been doing acupuncture, but definitely, yeah, twice a week. And I'll explain just a second. What the reasoning is that we try to flip the nervous system from from sympathetic to parasympathetic mode as much as possible. That is kind of the fight or flight response to the feed and breed, or rest and digest mode. And it takes usually during the treatment about 20 to 30 minutes for that to happen when you're doing acupuncture. And we hope that continues so that you're in that nice resting mode during transfer. Because I know that's what you guys like to see. And, for sure, feeling a whole lot better
blood flow. I mean, you can't, and the problem is, how do you promote blood flow? Which is when I became a huge acupuncture fan, when I realized there's nothing I could really do. I can thin people's blood with medication, but I can't dilate their blood vessels. I mean, and that's what, tweaking those nerves that innervate the pelvis with the acupuncture techniques can improve blood flow to the pelvis. More blood flow goes to the pelvis, the thicker and more lush the lining, the better the embryo has to implant. I mean, there's just no substitute for it. I mean, you can't say enough about it, because there's no pill you can take to do it. There's pills you can make your blood a little thinner, but you can't improve the blood flow with a pill. So that's where a conjunction of, you know, what we do and what you guys do can just make such a huge difference in success. And I've seen it in our miscarriage patients, in our implantation failure patients. It's just amazing how what the difference that it can make. I tried booking an appointment, but you're completely booked. That sounds like me. That sounds like me.
It's been busy, but we are open Tuesday through Saturday. So if you could DM me, that would be great. So I could let our receptionist know that you're having something coming up. And we're usually really good about getting patients in, so we shouldn't have an issue with that. We're here.
Okay,
And
good. You have a DM connection there.
FL Complete Wellness is our Instagram account. So thank you. We'd love to help you. And also after the it would be important. So it's just not like, I mean, that's where we usually continue on, you know, because that's half of it, right? But it's really nerve-wracking to do that 10-day wait or 12-day wait or however long. It feels like an eternity. So we try to work a little bit with still blood flow and stress relief during that time is important.
Which is ridiculously important. So that goes into one of the other questions that was submitted. Are there any ways to help implantation during the 2-week wait? Relaxation, stress management, blood flow, really, you can't stress it enough. I mean, It all seems so simple, but there is so much that goes into success, and you really have to look at it from a multifaceted standpoint to say it's not just here, give them a pill and tell them when to, you know, do whatever. It doesn't work that way. Patients who are having difficulties really need to look at a whole body, a whole patient approach, looking at everything, you know, from just the medical aspects of it to the psychosocial aspects of it to how's your relationship with your husband or your partner, you know, how is everything going? Because there's so many little things that can play into, you know, those fight or flight mechanisms. And if you've got too much adrenaline going on, you've got too much cortisol in your body, these are things that are going to act negatively against your success, and they can be modulated. They can be modulated with different, you know, techniques, and it's I can't stress it enough, really. So we got another question coming across the feed. What's the earliest you can take a pregnancy test? I'm worried to see a chemical pregnancy and getting my hopes up. Again, it depends. So if you know when you've ovulated and you haven't taken an HCG injection, you can take a pregnancy test pretty much 10 days from ovulation and it should be accurate. You won't really know if it's chemical unless you get blood done. So blood confirmation of pregnancy is super important because we follow those blood levels. And even if it is a biochemical pregnancy, it means something. It means something. It means a lot. It means something's going on in your body, maybe killing that pregnancy early, and that needs to be investigated. So you don't have to worry about seeing a chemical pregnancy. No, you want to let us know you're pregnant. We want to know you have a biochemical pregnancy. We want to know what your beta level is. Your beta level comes back at 15, and then it goes to 30, and then it drops back to negative. Okay, that's important to me as a doctor because I am going to evaluate you for different things in the face of that biochemical pregnancy than if I didn't know you had it. So test for pregnancy. Find out if you're having early pregnancy losses that early. Don't just say, oh, I'm waiting for a period. Oh, two days missed, 3 days missed. Okay, 5 days missed, I'll test now. No, test early. Be proactive. Because what you experience, you go and tell the doctor, and the doctor is going to do different things based on the information that you give us. If you never told me that, I had a patient who, and literally it was my nurse got the information out of her. And like, oh, she did, so we were doing an IVF treatment with her. And she says to me, she goes, oh, the patient didn't want to tell you. She went to another practice and she did an IVF treatment and had a transfer and didn't get pregnant. Mm-hmm. Well, the fact that she had an implantation failure, I am going to treat her completely differently, knowing she already did an IVF cycle. Yes. And I did, and thank God I did, because I worked her up for implantation issues, which I never would have addressed unless I knew she had a failed implantation. And she was embarrassed to tell me she had like gone somewhere else to see what they thought, which is fine. I don't really care. We're all out for you just to get pregnant. But I mean, if I didn't have that information as a doctor, I would have never identified that she needed, her blood was too thick. I would have never identified that she had an immune system that was too strong, that actually rejected the embryo from the other clinic, okay? I wouldn't have even thought of it. So, these biochemical pregnancies, like, don't be afraid, because even though it may not end up in a baby, it still gives the doctor information, and we can test you for more stuff. Because it really, really can be important. So don't be afraid to test, because if it happens, yes, it's biochemical, but let us know. Let us know. So
Yes,
you've seen that too, correct, Dr. Drew?
because when we see that too, naturally, patients just, like, it's positive one day, negative the next. I'm like, there's a reason for this. So, but not every practice tests for that,
Right. So that's another question. Do you recommend a person who has Hashimoto's? So Hashimoto's is an autoimmune disease, okay? So if you're identified with Hashimoto's and you have antibodies against your thyroid, there is the potential that you also have antibodies against other things, and you should be evaluated for those things. So Hashimoto's is not a problem for pregnancy. Many, 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 many women can get pregnant easily with Hashimoto's, but if you're having difficulties, it can be a red flag that can tell your doctor, say, hey, I think we should look at some other stuff. Okay, so that's where Hashimoto's can come in. Can a C-section cause scarring that could cause infertility? Highly unlikely. However, if the C-section scar is repaired poorly, you can get fluid stuck in it, and sometimes that fluid can cause the uterine environment to have a problem with implantation. It's quite rare. It's quite rare. But a C-section in general, usually patients do not scar from C-sections. It's incredibly rare. I mean, anything's possible, but it's not something that's a red flag. I mean, a patient comes in for a C-section, like, oh, this is why you're not getting pregnant. It's not a top cause on my radar, but we always do keep it in the back of our mind, because any surgical procedure can cause scar tissue, and scar tissue can cause infertility. So it's rare. It's quite rare. So if you had a C-section, I would look for other causes rather than blame the C-section first. All right, so we got some other, hopefully Erica's doing her update.
Oh, is she? Okay. Well, if we
I hope
can't,
so. I hope
and
so.
maybe we can do a quick, which you can join us after the live, and we can go live again just for a few minutes. It's just, but maybe Shirley can help us with Erica if you're listening.
All right. So we got a whole bunch of these other questions I'm just trying to get through here, and then I got some more that are submitted. This is great tonight, guys. Thank you so much for joining us. This is really, really, really super that so many people have tuned in. So best time of day to take ovulation tests, first urinary or later off. So your LH levels in your body, which is what your urine tests are testing for, they're going to peak between 9 and 11 in the morning. So again, we always tell patients second morning urine, but we're kind of assuming people are up at 6 and 7 in the morning. So, it depends on when you get up. So really, that morning urine between 9 and 11 is what you're looking for. Again, I've always referred to it as your second morning urine, but it depends on, your sleep schedule and stuff. So that's when your concentration is going to be highest. That's the best time to check. All right, so we got another one. Do endometriomas affect egg quality? Interestingly, endometriosis as a disease can affect just eggs in general. They usually come out looking dark. The lab doesn't love them, but still the dark egg from a young woman seems to make a beautiful baby. So where endometriosis is a bad disease, it doesn't affect all women the same way. So if you have an endometrioma, we're actually not removing them before we do your in vitro cycle, because we don't find that actually having that endometrioma in the ovary on ultrasound screws up the eggs around it. So, I mean, I'll frequently have a patient with a 4-centimeter endometrioma, and she has lots of eggs. There's eggs around it. I just put the needle and I just go around it, and I miss the endometrioma. Eggs come out beautiful. And I just don't mess with the endometrioma, because it is what it is. If I went to surgery, which we used to do like all the time, we're like, oh, endometrioma, got to take it out. Endometrioma, got to take it out. Like, it's a cyst, it's never going to go away, which is true. But if I go and operate on a woman who is still interested in pregnancy and, having the most eggs she can, if I go and cut her ovary and I shell out her endometrioma, which I do in a very conservative fashion, and I remove it and I make her ovary beautiful, I have probably injured her ovarian reserve. Now, we didn't know this years ago, so we always took out these endometriomas because we thought that they really had a negative impact. But the more recent literature says that you could do more harm than good by taking out these cysts. Now, sometimes if they're like, grapefruit size, you have to do what you have to do. But, smaller endometriomas and endometriomas, 4 or 5 centimeters, I certainly have stimulated patients very, very successfully and gotten healthy eggs and healthy embryos from them. So it really comes on a case-by-case basis. But in general, if we can drag our feet in operating on the ovary to remove an endometrioma, I certainly do. Because I just don't. The whole thing is, don't do any harm to the patient that would potentially cause her to have future problems. But I mean, pain patients are completely different than fertility patients. So there's different categories of endometrioma, endometriosis type patients. So, and then another question from the same patient: 30 years, stage 4 endo. What are the chances of success with IVF? Because you're 30, they're excellent. Okay, so age is really, really the key for patients who have endometriosis. The younger you are that you try a treatment, the more successful you're going to be. So if I try the same treatment with a stage 4 endometriosis patient at 42, I am much less likely to be successful at 30. I have had so many patients with awful, awful, awful endometriosis that we have helped, but they're under the age of 35, and that's really been the key to our success. So age, you cannot stress age in a bigger way, because I just can't turn back the clock. I wish I could, but I can't. What else do we have here?
Oh, it looks like Erica says she is pending. So I think there's a little.
So let me try again. Let's try.
Yeah,
again.
a little where you can invite her now in on the screen.
Okay, let's try. Let's try again. Let's pray. Keep our fingers crossed. Okay, so we're waiting for Erica. Let's see what we're waiting. Got another question here. Not pregnant, 4 months post miscarriage, suggested on things to talk to your doctor about. Well, it depends. So if somebody had a miscarriage. Oh, hey! Oh my gosh, Erica, she's here. Okay, we'll get back to the question.
Hi.
Can
you guys hear me?
Yeah.
Oh my
I
God,
can hear
this
you
is
fine.
my first live. I'm so nervous.
Oh,
I felt like my students. I was in the waiting room, and I'm like, I'm here.
I'm here. Let me in. So
How
Erica,
are you,
welcome.
ladies?
How's the baby?
She's doing great. It's a little crazy. Danny's on call, and he just got called to go to the hospital. And I was like, wait, but you got to take care of the baby. So he's
Thank you for
here, and yeah.
I really appreciate it.
No,
Appreciate you
please.
being here.
Thank you guys for having me. Hi. Oh, I'm a little nervous.
No, that's fine.
Do you just want me to start talking?
Yeah, I just, what?
Okay.
Like start with the beginning of your story, because I know it's a long, beautiful story. Again, I don't know if anybody, if anybody's watching who follows you, like that video brings people to tears, like your journey.
God.
But
Thank
so
you.
start back with you and Danny and how you met, and take it from there.
God. How we met, MySpace years ago.
MySpace?
Yeah.
Wow.
We had so many friends in common, and he walked 15s with my best friend. So I was her top 8, and we met through there. It's gonna be 18 years ago this year.
Wow.
It's crazy. Yeah. So yeah, we dated for 8 years. And I'm sorry, I didn't introduce myself to some people. I'm Erica Galliano. I've been a patient of Dr. Wood and Dr. Duro for 3 years. And they are amazing ladies, as I'm sure those of you that follow them know. So yeah, Danny and I met over 18 years ago. And we dated for 8 years. We got married. And 3 years into our marriage, we went to NOLA, our first vacation, as a couple, and we're like, all right, we had the baby talk. It's time, we're ready to start having a baby. So, yeah, we started trying. About a little over a year had passed, and nothing. We tried everything that we possibly could. We bought every ovulation kit you can think of, like from the cheapest to the most expensive. We read all sorts of things, like anything anybody would tell us, we tried, and nothing. It was like a negative
Again,
test
how old were you
after.
at the time? You were young. I mean, you were
I
like super
was
young.
well, I got married at 28, so I was maybe 31 when we started trying. And a year and a half had passed, and yeah, nothing had happened. So I have to laugh. Danny's in the background telling me, stop saying, stop saying, I'm sorry. I'm so nervous. Sorry, hold on. So,
It's okay. It's fine.
time had passed. We tried and nothing had happened. So we said, okay, it's time to start talking to somebody about what we've been going through. So we started with my gynecologist. We went to go see him for my annual checkup. We discussed, we had been trying already for a year and a half almost, and nothing had happened, and what was the next step that we had to do. So in that, he discussed, okay, these are your options. And then I had my checkup. My gynecologist would always check my neck. I know I have a thyroid. Honestly, I did not know the function of a thyroid, but I know he would check it, and I was like, okay. So in that checkup, he tells me, Erica, you have a nodule on the bottom left of your thyroid. So before we move on to the next step of trying to conceive, I would really like for you to go get that checked out. So I said, okay, no problem. And I left there. I was trying not to get too nervous about it. So I quickly made my appointment. My primary sent me to the endocrinologist. I went with Danny. And we did an ultrasound. I was able to see the nodule. It was pretty big. And then from there, they also did a biopsy. And they said, okay, we'll call you in a few days with your results. A few days passed, and they called me with the results, and they were positive. So I had thyroid cancer. So I still say that, and it's a little crazy. Yeah, sorry. So I had thyroid cancer, and we had to decide, okay, what are we gonna do? We have to work on me before we can do anything with the baby. Lots of appointments, lots of tests were run, and finally it was time for me to have a thyroidectomy. I walked in, I was like freaking out, and they explained to me, okay, you're gonna have your thyroidectomy. We're gonna remove the bottom left portion of your thyroid. And if we're in there during the surgery and we see anything else that we don't like, we're going to go ahead and do the biopsy right then and there as well. And if it's cancer, we have to remove it as well. So I went in, they told me best case scenario, we go in, we just remove the bottom left. Worst case scenario, we find other stuff and we have to remove the whole thyroid and have a full thyroidectomy. So I said, okay. And I went to sleep, what felt like a minute. I woke up, it was 8 hours later.
With long surgeries.
Yeah, it was 8 hours later, and I woke up with the worst case scenario. I had a full thyroidectomy. They removed my full thyroid and 26 lymph nodes as well. So yeah, I woke up with no thyroid. At the time, I really didn't know what that entailed. Sorry. So after that, I woke up, okay, we don't have a thyroid. What's the next step? The doctors went ahead and told me that from now on, I had to take a pill to mimic my thyroid. For those of you that do not know, like me, what functions your thyroid do or what it is, your thyroid is located right here. It's in the shape of a butterfly. It is something that we need. It controls so many things. Dr. Wood, chime in because I'm freaking out.
Yeah, no. Yeah, but again, replacement therapy is obviously, something that works quite nicely in order to maintain your bodily functions, because you need thyroid hormone for your body to function properly.
Thank you, because you gave me a break. I had a big moment. So after that, basically I need to take Synthroid or levothyroxine is what it's called. And because I didn't have a thyroid, they start you on like a step method, a ladder. And I started from the bottom and slowly but surely increased dose until they found the perfect dose for me. That took a few months. Every time that I would change the dose, I'd get all the side effects again. My hair would fall. It was pretty rough. Hello, sorry. But luckily I'm here, and I'm cancer free. I've been cancer free for the past 4 years. So I'm blessed to be here and be able to share that portion of my story. That's how our infertility journey started. It was a few years after that, and it's still continuing. After we finally got everything squared away with my thyroid and my levels were good, we went ahead and got the green light from our endocrinologist, and he said, okay, you guys can go ahead and start trying to conceive again. Everything looks good with your thyroid, you're cancer free, your levels are good. So we went ahead and we automatically saw our gynecologist again. And he told me, Erica, look, you were trying already for a year and a few months before this. Now you've been diagnosed with this, you're doing good, but I think, I would recommend for you to see to go to a fertility clinic and see a fertility doctor. So I said, okay, no problem. And we made an appointment with our first fertility clinic. We did an IUI right off the bat. And I was just so ready to have a baby. We had, I think 3 years almost more or less had passed. And I was like, okay, I'm done. I already passed this hurdle. We're moving on to the next one. And yeah, we did an IUI. I honestly went in blinded. I had no idea what it was going to entail. And it didn't work out. I was 100% sure, okay, I got this, medicine, to have a baby, it's going to happen. I didn't even look at the statistics of it working. I don't know. I remember being so naive and just walking in and okay, I got this. And it didn't work out. And it was so heartbreaking. I think between that and the cancer, it was just I was an emotional mess. So I told Daddy, okay, I need a break. We need a break. I need a mental break, a financial break. We just needed to disconnect from everything for a little bit. So we went on vacation for a few months. We traveled a lot. I started seeing a dietitian, and I had been able to lose 30, almost 40 pounds. I felt great. I took some time off, which I think is really important when you're going through all these treatments. And I worked on myself, and I worked, on our relationship as a couple. And yeah, I was finally, after 6 months of taking a break, I was ready. And we went back to the same clinic with a different doctor, because our first doctor had moved to another state. So we left her, we missed her, but we're okay. So we saw our second fertility doctor, and we did 3 consecutive IUIs, and all 3 of them failed. I think the hardest part was that we did them during the holidays. And one of the failed cycles, I found out on Thanksgiving. I think the holidays are definitely the hardest when you're trying to conceive. And yeah, so we did. I know. I'm sorry. I'm trying to put it together.
Yeah, you do it, Eric. You're doing great. It's just
thank you.
It's just so there's so many people going through this. I mean, and again, it's such an emotional process because you just have so much hope, and then your period comes. You have a negative pregnancy test. It's just it's for patients. It's so devastating. And again, what I always try to do as far as my job is saying, look, we have this, we have this, we have this. If this doesn't work, we always have another step. We always have another step. We always have another step. We always have something else. We're going to start small because it's not that crazy expensive. The success rate isn't that great, okay? But right, you're starting from zero. So hey, to raise your success rate to 10 to 15%, I mean, is better than zero. But it does seem really unbelievable to a lot of patients. And it's like, oh my God, I see the egg. You guys put in a gazillion sperm at the right time. Why aren't I pregnant?
Yep.
It's so, the frustration level. I mean, again, I've been there myself. I mean, it was, my kids are 20 and 22, but I mean, I've been there myself. It's just like, what the frig? Like, why didn't this work?
Yeah.
And then, I mean, I'm just like, sign me up for the next treatment, because again, as a doctor, I kind of knew there's other treatments out there, but sometimes patients don't know. It's like, what do I do next? Like, it failed. Like, am I never going to have a baby? It's just, that's so hard.
I think, I'm sorry, I think what was the hardest for us was that to this day, we have unexplained infertility, and we've run so many tests on Danny, on myself, together, and we, till this day, after all the tests, have no idea why we struggled for so long to try to get pregnant. So yeah, it's like, sometimes I would just tell Danny, I wish that they would tell me, this is the problem.
This is right.
So yeah, so I'd be able to know, okay, this is the problem and this is what I have to work on. But when you don't know, it's even harder, because you don't know if it's something you're doing, he's doing, we're doing together, and it's just so hard. I mean, it's hard in general, but I sometimes wish that I just knew the answer to why. So yeah, so we tried 3 different IUIs. We said, okay, let's try back to back, because maybe all the meds are in from the first month and they'll help the month and the third month, and I don't know what we were thinking. So we tried 3 back to back, and unfortunately none of them worked. So the following year, the last IUI we did was in December, and I told Danny, okay, let's take a month off. It's January, the beginning of a new year. Let's set a new goal. So we discussed different options, and we decided to change doctors and clinics all in general. So we moved over to IVFMD with Dr. Wood, and we had our first consult, and I loved Dr. Wood automatically, because she told me, this is what you have to do. These are options. This is what you have. And she laid everything out on the table for us, and I appreciated that so much. So she basically told us, I think it's time for you to do IVF. And that's what I suggest. You have different options if you choose. So we decided to go with what she suggested, and we did IVF. And I started seeing a few weeks after I met Dr. Wood. She talked to me about acupuncture. I also have 2 friends of mine that had gone to go see Dr. Dural as well during their treatments, and they had recommended her as well as Dr. Wood. So I said, okay, yeah, I'm going to do it. So I started doing acupuncture in about, I think, a month after I spoke to Dr. Wood, and I saw her consecutively throughout my IVF cycle, twice a week. I started going there because I thought it helped me with just trying to get pregnant, and it helped me with so much more. I would leave there, and Danny was like, I'll pay for you to go 3 times a week. You just leave there and you're so like zen and you're so calm, because I was just a mess before. And I'd cry all the time, and I was just so nervous, and like acupuncture helped me just in all different aspects, feel whole again and normal sometimes. And in addition to helping me, with my fertility. So yeah, the combo of Dr. Wood and Dr. Dural together, I did my first treatment, and it was successful. It took a long time. My body was not absorbing.
Not with the program.
My body. I'm like, every time something happens, they're like, oh, 2% of women, this happens. I'm like, oh, there's me. It was always me. That small percentage, I'd always fall into there. So, yeah. So Dr. Wood basically told me, I got this. In those words, she was like, I got this. We're going to keep just giving you the meds and raising them. And we're going to do this. And I was like, okay. And I liked her mentality. And she's like, I got this. And I said, okay.
I never lost before. That's
yeah,
what I told you.
she did it.
Never
She's
lost.
like, that's exactly what she said. I've never lost. I got this. And I was like, okay. And I remember I left with Danny, and I was like, she's got this. Like, you convinced us wholeheartedly. And I was like, okay, here we go. And it was successful the first transfer. So we had 2 frozen embryos. We decided to keep the sex a surprise. And throughout my whole pregnancy, we kept it a surprise too. So now we have our little Stella Hope, and she is 5 months, almost 6 months old already.
This is so cute.
She's adorable. I just met her today.
Thank you. I know. I have to take her over to see Dr. Wood.
So we have the other surprise in the freezer.
Yes. So the other surprise, we know that they were both the same sex. So when Stella was born, we're like, oh, we know that that'll be our little Zoe Hope. I'm sorry, Zoe Love. Hopefully one day. Yeah. So that's like a summary of our story. I don't know if you guys have questions or anything else you'd like me to say.
Well, again, Erica, thank you so much for sharing. Again, it's such an emotional journey, and you know, it's so great that patients can hear what other people went through. I think it is so supportive, and it just is, yes, I can get there too. Like I felt that way. I feel that way now. Like, what else can I do? Who else can I turn to? What else can I look out for? And I think and then that's what National Infertility Awareness Week is. It's kind of changing the conversation. It's like, let people know you went through it, and it does work. Have faith in the process. You know, have faith in the medicine, have faith in the other things we recommend, have faith in the nutrition, the acupuncture, the stress reduction, all of that stuff. I mean, and again, talking about it just in general, I think really helps just reduce anxiety, reduce doctor fear. You know, I mean, I hear from my guy, I have a patient to send you, but she doesn't want to go. She's afraid of fertility specialists. I'm like, we're not scary. We're helpful. Like, you know,
I was scared. I was scared, but I went through so much that I just learned, like, they're human and they're here to help me. So I need to not be scared. I need to speak up and talk when I need to talk to them and not be scared. But I would walk into your office like terrified. And Danny's like, she's not scared. Why are you scared? It took a few weeks for me to like be like, okay, she's good. And now I see you, the TikTok doc, jumping and dancing, and I'm like, she's not scary at all. I don't know.
I'm fun.
I know. And I'm like, why
was I
scared? But it's just like the whole journey is just scary, and you feel alone. And for a long time, out of my 5-year journey, I didn't speak up for the first 2 years, like at all, to anybody. And it was just Danny and I. And then year 3, I started feeling a little more comfortable. Because imagine we had been together for so long and everybody's like, what are you guys waiting for? And then I'm a teacher, and then people were just like, you work with kids, why don't you have a kid yet? And it was the constant question. Yeah. And my students would ask me, Miss, why don't you have a baby yet? And it was a lot of baby showers, gender reveals, that I go to, because obviously, you know, I love my friends and I'm there to support them. But then I'd get in the car and cry like all the way home. A lot of that, just a lot throughout the years. But yeah, so those of you that are listening, that are still in the wait, I hope that my story gave you a little bit of hope. Because for the first like 2 years, all I did was just go on Instagram and just follow people that would bring me hope and inspiration, because I felt alone for a long time.
Erica, thank you so much. Thank you so much.
No problem.
Love you, Erica.
I'm just now. You gotta pick up your frozen kid.
You will definitely be seeing me. Danny wants to do a cameo with Stella.
Hey, there's
Hi, Stella.
Oh my gosh, she's got a little orange bow.
Stella.
and her
shirt says.
And her little pineapple
says,
skirt.
my mom is a warrior.
Yeah, yeah, amazing. You know, again, I recently, you know, went through the journey with my niece. My own family went through this. IVFMD, you know, helped. Hey, Daddy, how are you? So it's so amazing. I mean, every single time, like, I look at my own niece's son, like Alden, it's just like, we made him. Like, it's just we helped have him, and now she's pregnant with number 2. Oh my god.
Oh, congratulations. It definitely takes a village. We have such a huge support system and even from people that I've met through the journey, we became friends. And I think that's what it's all about, like not feeling alone anymore and talking about it and bringing hope to other people still waiting.
It reduces stress. And
Yeah.
I don't have a pill for that. I don't have a pill for that. I have the support of such supportive teams, like my acupuncture team. But, you know, when you start to connect with people online and you start to listen and you start to like advocate for yourself and just ask your doctor questions. I love it when patients bring me questions. I'm like, sometimes patients bring me like ideas and I'm thinking, let me research that. Like that does, yeah, okay. Like we could try that. Like, I mean, there's different things that patients will bring to me. I mean, again, like I read like 24/7. You have no idea the stacks of journals I go through all the time, just to try to figure out, oh, maybe we could try that. Maybe we could try that. And I always think of a patient like, you know what, there's nothing out there. Like, what else could I do? What else could I do? I mean, I have just difficult cases in my mind all the time. Like 24/7 as I'm leafing through things. I remember in 2005 it was a very, very interesting case and it like never been heard of before. And I was leafing through a journal as I'm drying my hair. Okay, yeah, that's multitasking. And I'm thinking, oh my God, they used this stuff to help with fertilization with ICSI. I took the article and I went to my embryologist like, can we do this for this patient? Because my patient had the same problem. And it hasn't been published before. And I have actually a patient who has 2 babies from me reading through my journal while drying my hair.
That's amazing.
I mean, very rare. I mean, super rare. Like, you know, like I think there's only like 2 rare babies worldwide using that technique.
Wow.
I mean, it's that rare. But again, I had a patient with it. So I mean, that's just, I'm always trying to just think for my patients and what else could help them, what else could help them, what else could help them. And it takes a team. It takes a doctor, it takes a support team, it takes, you know, family, friends, everything. So that's why National Infertility Awareness Week, we just want to tell your story, you know, find out who you could support out there. It's so important. And oh my God, Stella is so adorable. And you were just literally so brave for doing your first Instagram live and you did that update and
oh my goodness, I was waiting. I was on for the longest time, but you were talking and answering questions and I felt bad interrupting, but I was like, I'm in the waiting room.
Oh, and then you didn't mention when you came back for acupuncture right before you had her.
Oh, yes. So let me tell you that I went in at 39 weeks to my doctor and he was like,
put me
you're
into labor?
good. No, he told me, you're so good. She's not coming anytime soon. You're not dilated at all. And I was like, okay, no problem. But I was having a little bit of pain in my back, nothing crazy. But I said, you know what? I'm going to ask my doctor, is it okay if I do acupuncture? He's like, yeah, for sure. Go do it. I went to go see Dr. Duro on the 29th of October and Stella was born. And Stella was born on the 31st. My water broke. And I had Stella 2 days after acupuncture.
It's crazy because that's my daughter's birthday. And I was like, I bet you're going to have a Halloween baby like I did. And
Halloween baby, here she is.
You're going to have the best birthday party, Stella. It really is. It's fun.
Yeah, and we love Halloween. Everything just worked out. And I guess after our long 5-year journey, I can say I never understood, like, why are we going through this? What did we do wrong? And, you know, you question everything. But at the end of the day, you try your best. You do what you can do. Find doctors you can trust and you listen to them and you do what they ask you to do. I know one thing that really helped me was the last couple of weeks before my transfer, I was doing a Mediterranean diet, which was something that Dr. Duro recommended to me. And I loved it. Like, she just talked about it one day and I said, oh, I'm going to look it up. And I felt like it really helped me for my transfer. So yeah, just another thing that I did want to mention, because you said something about journals, I journaled a lot. It helped. I started writing letters to my unborn baby that I didn't know if I would have one day. And now I have journals of just like journal entries to read to Stella or to have her read when she's old enough. And I also would have agendas from the first appointment that I did, which was just my IVF agenda. And I'd write down all my appointments, all the exams, all the results. So it was helpful when I transferred from one office to the other. I was able to walk in with my agendas, and I already knew everything that I had done, and the results. So I was able to, like, you know, give you guys the information. So those are just a few things that I think that really helped me, that I just always kind of give as advice to those of you going through the IVF process.
I remember your notebook. I was like,
I know. I think it's the teacher in me. I just had an agenda and I'd
The
write
teacher
down
in you, yeah.
everything, and it helped me, and I feel like it helped you guys because I'd show up with my agenda. I don't know if it helped you guys or not, but
no, it
I was I
Oh
thought it
no,
helped you guys.
definitely from a doctor standpoint. Again, I have a really good memory, okay, but I'm like, and I write things down in your chart, but I can't remember everything. So,
No,
you know,
that's fine.
when patients have kind of like, yeah, this happened, I'm like, okay, oh, you're right, thank you. Like
Yeah.
when you know, a patient is involved in their care, I personally, I don't take any offense to it. I love it. I think it's so wonderful because the more you understand about what I'm recommending and the rationale for it and what you've been through, what you've gone through, what we're planning to do, why we're planning to do it, what we're trying to accomplish here, the less stress you have because you understand like where my head is, you know, from a medical standpoint. She's got the hair.
Stella's getting wild. Hold on. Here's Dad.
But
Bye, guys.
just do
She
one
said
more
bye.
point. Erica actually had a spike in her TSH and her thyroid hormone right when you got pregnant. And if you weren't seeing a reproductive endocrinologist who knew about that, like Dr. Wood, it would be easy to miss that. Like I would say, you know, because like you got your thyroid hormones checked like right away when you got your pregnancy test. You had to adjust.
Yeah, I was always concerned because they told me that the minute I got pregnant that, you know, it could throw my thyroid a little off of whack. So
It's thyroid goes
Dr.
crazy.
Wood, Dr. Wood was on that right away, thank God. But yeah, I don't know if you guys, I don't know. I did my first live. I don't know how I did. I hope that
You did. Oh my God,
my
Erica,
story shared a little bit of hope.
We can't thank you enough for sharing. I mean, it really,
Thank you so
really,
much.
I'm sure it means a lot to all of our followers, everybody out there, our patients, people who are afraid to come to fertility specialists. Like it's just, I think it gives people hope, that again, you can have a baby. Advocate for yourself, find a team who works for you. And that's what you did. And again, you'd be surprised. You may not, I've had so many patients who have come back, they're waiting to have, they have a little frozen guy, and they don't need my services anymore.
Oh no.
Sometimes that first baby an unexplained patient turns on the baby machine.
I hope. I'm like, I hope I'll have like 5 more. They're all like, she's so good.
You'd be surprised. You'd be surprised. I'll be walking through Target, and I know I helped, so and so I bumped into at Target with baby number 1. Then she's got 2 kids in the cart with her. I'm thinking, did you cheat on me and do IVF with someone else? like where did those kids come from? She's like, oh, Dr. Wood, oh my God, this is the one you helped us with. And then he came, and then she came, and then I'm like,
oh wow. And then they didn't stop coming.
They didn't stop coming. I mean, all Dr. Wood did was turn on the baby machine with baby number 1. Okay, trust me.
I hope he turns it on, but
I've got hundreds of those cases. I've got hundreds of those cases. It's just like, I'm telling you, you're walking through the supermarket, you just bump into somebody, and you're thinking, I know her. Where did all those children come from? No,
hopefully that'll be us one day.
Hey, I've been in Broward County for 20 years, so I've made a lot of babies in this area.
You've made it. I started seeing you, Dr. Wood, and then I think I posted one day like, oh, that was my doctor too. She we had our baby through her. We had our baby. It was like 3 or 4 people. So we share a lot of my friends share you in common as our baby maker.
I've been 20 and a half years in the same area. So it's just that and my nurses run into people. We run into people at restaurants. We run into people, in Publix and Target. And they're like, guess who I saw? Guess who I saw?
Oh my goodness.
Yeah, I know. Because our nurses, that's the other thing that I really want to say just about IVFMD, and especially my staff. My medical assistant, my IVF coordinators, my nurse have been with me, all over 10 plus years. And, they are invested in our patients as much as, you know, the physicians are. I mean, they remember our patients. They're like, oh, do you remember I saw so-and-so, so-and-so? I mean, it's, you know, they've been doing this for so long, and they have such a commitment, you know, to helping everybody. And it's like it's a vocation. I did a thing with some medical students, and they said, you know, well, why do you like your job? And I'm like, really? Like, you want to ask me that question? Like, how could I not love my job? You know, I'm sorry, I know orthodontists get satisfaction from straight teeth, but, you know, I mean, there's just no comparison to helping people have little Stellas. There's no way. I mean, people are like, ooh, my smile is beautiful. Like my daughter wants to be an orthodontist. So that's why I say that. But, you know, you can't compare orthodontia to making babies for people, you know. It's just one of the most wonderful jobs in the world. And I know that the staff that work intimately for me feel the same way, and they have that commitment to patient care, and they're invested in your journey as well. And so I can't stress enough how you know, at least myself and our practice and our practice in Cooper City, really, you know, everybody who is intimately surrounded by me and helps me out wants to help the patients as well.
I can say from a patient's point of view that you are 100% right. I did visit 3 different clinics in our journey, and walking into IVFMD is just like, you feel like you're part of a family and everyone's rooting for you type deal. So you walk in and everybody knows you, they remember you, your story. And I felt so good walking into IVFMD. So thank you. And walking into Dr. Duro's offices was always like my favorite as well. So thank you guys.
Mm-hmm. And we're not scary either. We have needles, but we're not scary.
No, I know. Don't take offense. I feel like everybody's scared just because of, like, you know, your journey, and especially when you're starting off, it's just scary. So much that you don't know what to expect. So it's just intimidating. Mm-hmm. But you guys are great.
I'm so glad that you're able to share your story, and everybody else who is, I've been reading all these comments that they're just so happy to hear what you had to say. And someone says, yes, I needed to hear this today. And so that's why I said, you never know who needs to hear this.
And I think, I'm sorry, I interrupted you. I shared just our pregnancy announcement, and it was a video about how we got Stella. And then from there, it just took off, and I had so many people reach out to me that we didn't even know that since IVFMD reposted it, you guys reposted it. I just had people that I've never met before just telling me, you're such an inspiration. Thank you for sharing.
It's such a beautiful video. Like, I was in tears when I watched it. I'm like,
thank you.
How did she do that? Like, do you have like a program that does that?
No, Danny does that, and it was so hard to do a 2-minute video of like 5 years of just shots and doctor's appointments, and everything we went through. It was really hard. But yeah, I think that's what really helped me continue to share. I received so much love from our family and our friends, and in addition to people just sending me messages. Thank you for sharing. I needed to hear that. I really appreciate it. And it made me braver because I was terrified to share. And it made me continue to share. And then I had people that didn't know anything about IVF that just loved us, and they wanted to know what we went through. And I did a lot of posts trying to explain IVF to a lot of people that don't know the process, and they didn't realize we were going through all those things. So that's what this week is about, just sharing your story if you feel comfortable enough, and if you don't, just follow along. And
we'll repost that video so that IVFMD can repost it, because it is such the music, and whoever like choreographed.
It was Danny.
It was Danny. Oh, again, but this is like a side hobby for him. Like,
yeah. So it's funny because we would go on vacation all the time, but it was around treatments. Nobody knew what we were doing. And so we would plan random spontaneous trips. Okay, we're going here. And everyone's like, you guys are so awesome. You guys plan such spontaneous trips. And I was like, people don't know we're picking up and going because we have a break. And this is the time we could go. Like, you could never plan vacations ahead of time when you're doing treatments because you never know. So Danny picked up the hobby of doing videos, short like clips of our vacations. And that was just like our way of disconnecting when treatments weren't going good. We would just pick up and get in the car and just drive up north or drive to different places and do spontaneous road trips. And Danny picked up that
So
hobby.
has Stella been on a road trip yet?
Yes. So there's a church in St. Augustine.
Oh, I saw that. I saw you posted
Yeah,
that. Yes.
That's a church, and a lot of people, there's a saint there that a lot of people like to go to pray for infertility. And if you're struggling with breastfeeding or if you've had any miscarriages, so a lot of people go there, and it's beautiful. Like it's the pregnant Virgin Mary, and so many people go there, and it's so peaceful. So we prayed there for so long. And I told Danny, oh, I'm gonna cry. I told Danny, our first trip has to be there with Stella. So we went there for January. Yeah, we went and we took pictures in front of the chapel. We went to a mass, and the priest prayed over Stella. So it was a big deal.
God,
yeah.
So
and that was our first road trip. And then we took off to like North Carolina, and she saw snow for the first time. So yeah, it was a lot of fun.
Oh my gosh. Well, thank you so much. Shirley said she's going to share on our IVFMD your video, because it's just like the fun. It's just such a heartwarming video. So we're again at 8:30.
I'm sorry I talked so much.
Erica, I can't thank you enough for being so courageous. Number one, to do your first Instagram live. Okay. I mean, because that's just like, you know, and just coming on and sharing your story. You have no idea. I mean, how many people this is really going to help, just to get the courage to seek help, to just have hope, to have support, things like that.
Thank you.
Thank you for being supportive.
No, thank you guys for having me. I really appreciate it. And I love you guys. You know that you will always hold a special place in our hearts because you brought us to Stella. So thank you both very much.
All right. Well, good night.
Thanks
everyone.
Good night,
Thanks everyone for listening. And again, just a big hug. And oh my God, I can't wait to meet Stella.
I want to take a screenshot of us so you guys can smile. I did it. All right. Thank you, ladies, so much for having me.
Thank you.
I'll see you soon. Bye, guys.
All right. Good night.
Bye. Thank you.
Bye.